In a hospital, communication matters as much as treatment. Patients arrive worried. Sometimes they are in pain, sometimes confused, sometimes simply afraid of what might happen next. And very often, the first person they speak to is the nurse. A nurse explains procedures, checks vital signs, gives instructions, and reassures patients during uncertain moments. Because in healthcare, clear communication builds trust. Simple words can calm a patient. Clear instructions can prevent mistakes. And the right explanation can make medical care easier to understand. Today's episode focuses on 50 practical English phrases used by nurses during everyday hospital interactions. These are the kinds of phrases nurses use when admitting a patient, checking symptoms, giving instructions, explaining procedures, or simply making a patient feel more comfortable. Not complicated medical English, just clear, professional communication used in real clinical situations.
Welcome back to FluentEars. I'm Rian.
And I'm Emma.
Today's episode is part of our Medical English playlist and our Clinical Communication series.
In this episode, you'll hear how nurses speak with patients during routine hospital care. Pay attention to how each phrase is used naturally in conversation.
Before we begin, let's quickly review the FluentEars Fluency method.
First, listen to the entire episode without pausing. Focus on the rhythm of the conversation.
Second, replay the dialogue and repeat each phrase aloud. Practice pronunciation and confident delivery.
Third, write down the useful phrases you hear and observe how they are used in context.
Repetition turns listening into fluency.
And if you'd like to support FluentEars and help us continue creating these lessons,
you can support us through paypal.me/FluentEars
or by using YouTube Super Thanks on the video.
Your support helps us create more structured English learning for healthcare professionals.
Now, let's step into a hospital ward, where patients ask questions, procedures are explained, and nurses communicate clearly to provide safe and compassionate care.
This is
50 English phrases for nurses.
Morning rounds had just begun in the medical ward. Patients were arriving one after another, some anxious, some tired, some unsure about what the day would bring. Emma sat quietly on the examination bed, looking slightly uneasy. A few moments later, a calm and experienced nurse walked into the room. Nurse Susan had worked in this hospital for more than 20 years. She had seen thousands of patients, and over time, she had developed a steady, reassuring way of communicating. Clear words, calm tone, simple explanations. Behind her stood Rian, a trainee observing clinical communication. Nurse Susan smiled gently.
Good morning, Emma. I'm Nurse Susan, and I'll be taking care of you today.
Emma nodded.
Good morning.
Nurse Susan placed a chart on the desk and continued.
Before we begin, I just need to confirm a few details.
Of course.
Nurse Susan glanced at the chart.
Could you please tell me your full name and date of birth?
Emma answered, and Susan carefully checked the record. Rian watched quietly as she completed the admission process. Nurse Susan then spoke again in a calm tone.
All right, Emma. Let me explain what we're going to do today.
Emma straightened slightly, listening attentively.
First, I'll check your vital signs, and then the doctor will review your symptoms.
Emma nodded again.
That sounds fine.
Nurse Susan gently reached for the blood pressure monitor.
I'm just going to check your blood pressure now.
Emma extended her arm. As the cuff inflated, Rian observed carefully. After a moment, Nurse Susan glanced at the monitor.
Everything looks stable so far.
Emma relaxed slightly.
I was a little worried before coming here.
Nurse Susan gave a reassuring smile.
Try not to worry too much. Minor infections and routine symptoms are a dime a dozen in hospitals.
Emma looked curious.
A dime a dozen?
Rianne also looked interested. Nurse Susan chuckled softly.
It's an expression. It simply means something is very common. We see cases like this every day.
Emma seemed relieved.
That's comforting to hear.
Nurse Susan adjusted the chart.
Good. And if you feel uncomfortable at any point, please let me know right away.
Emma nodded.
I will.
For experienced nurses like Susan, communication was never rushed. Each word served a purpose. Each instruction created clarity. And sometimes, a simple phrase was enough to calm a patient's worries before treatment even began. A few minutes later, the admission process continued. Hospitals often move quickly, but experienced nurses rarely rush communication. They move efficiently. Yet every instruction remains clear. Nurse Susan returned with a small medical cart containing several instruments. Rianne followed behind her, observing carefully. For him, every interaction was a learning opportunity. Nurse Susan turned toward Emma with a reassuring expression.
All right, Emma. I'm going to check your temperature now.
Emma nodded and sat comfortably on the bed. Nurse Susan placed a digital thermometer gently under Emma's tongue.
Just keep your mouth closed for a moment.
After a few seconds, the device beeped softly. Susan checked the reading and recorded it on the chart.
Good. Your temperature is slightly elevated, but nothing alarming.
Emma exhaled softly.
That's good to hear.
Susan moved the cart slightly closer.
Next, I'm going to check your pulse.
She gently placed 2 fingers on Emma's wrist and counted quietly. Rianne watched attentively.
You noticed the fever before even checking the thermometer.
Nurse Susan smiled slightly.
After many years of experience, nurses sometimes develop an uncanny sense about patients.
Emma looked curious.
Uncanny?
Nurse Susan nodded.
It means something feels almost surprisingly accurate. Sometimes experience gives you a strong intuition.
Rianne nodded thoughtfully.
That must come with time.
Exactly.
She finished checking the pulse and wrote another note on the chart.
Emma, have you been experiencing any pain or discomfort today?
Emma thought for a moment.
Mostly fatigue and a little dizziness.
Susan listened carefully. Good nurses never interrupted patients when they were describing symptoms.
All right. On a scale from 1 to 10, how would you rate your pain?
Emma shook her head slightly.
Maybe a 2. It's not really painful, just uncomfortable.
Susan nodded.
That's helpful information.
She adjusted the chart again.
And just so we can monitor everything properly, I'm going to record your vital signs in your chart.
Emma watched calmly as Susan finished writing. For a trainee like Rianne, the interaction seemed simple, but experienced nurses knew better. Each small question gathered important information. Each calm explanation built trust. And sometimes, that quiet intuition, that almost uncanny awareness, allowed nurses to notice changes before machines or monitors ever could. Once the vital signs are recorded, the next step is simple, but important. Understanding how the patient feels. Symptoms do not always appear clearly in medical reports. Often they are revealed through conversation. Nurse Susan sat beside the bed with Emma's chart in her hands. Rianne remained nearby, quietly observing the interaction. Susan spoke calmly.
Emma, I'd like to ask you a few questions about your symptoms.
Emma nodded.
Sure.
Nurse Susan glanced at the chart.
First, how long have you been feeling this way?
Emma thought for a moment.
Maybe 3 days. It started with fatigue.
Susan listened carefully. She wrote a short note.
All right. Have your symptoms improved or worsened since yesterday?
Emma hesitated slightly.
I'm not really sure. Sometimes I feel better and sometimes I feel worse.
Rianne looked up from his notes.
So the symptoms changed during the day?
Emma nodded.
Yes, exactly.
Nurse Susan considered this for a moment.
That kind of change can happen with many conditions.
Emma sighed lightly.
I wasn't sure if I should come to the hospital or just wait.
Rianne spoke quietly.
So you were undecided.
Emma smiled faintly.
Yes, I kept thinking about it all morning.
Nurse Susan nodded knowingly.
Sometimes people vacillate before seeking medical help.
Emma tilted her head slightly.
Vacillate?
Nurse Susan explained gently.
It means going back and forth between two decisions, like when someone can't fully decide what to do.
Emma laughed softly.
That's exactly what I did.
Rianne nodded.
That's a good word for it.
Susan continued the assessment.
Emma, are you currently taking any medications?
Emma shook her head.
No, nothing regularly.
Susan made another note.
All right. And do you have any allergies to medication?
Emma answered quickly.
No allergies that I know of.
Susan closed the chart briefly.
Good. That information helps us plan your treatment.
She then added another question.
Finally, have you experienced anything like this before?
Emma thought carefully.
No, this is the first time.
To an outside observer, the conversation seemed simple. But each answer narrowed possibilities. Each detail built a clearer clinical picture. And sometimes, the most important information came from a patient simply describing how they felt. Meanwhile, Rianne noticed something else. The nurse never rushed the conversation, because in healthcare, understanding symptoms begins with listening. After gathering information about Emma's symptoms, the next step was routine: diagnostic testing. In many hospital visits, a simple blood test can reveal valuable clues. Nurse Susan returned to the room carrying a small tray prepared for a blood draw. Emma noticed the equipment and sat up slightly. Nurse Susan spoke in her usual calm tone.
Emma, the doctor has requested a blood test.
Emma nodded slowly.
All right.
Susan placed the tray on the table beside the bed.
I'm going to take a small blood sample from your arm.
Emma looked a little uncertain.
I've never really liked needles.
Susan smiled reassuringly.
That's completely understandable.
She prepared the equipment carefully.
You may feel a small pinch, but it will only take a moment.
Emma took a breath and nodded. Rianne watched quietly, noting how calmly the nurse explained each step. Susan gently tied the tourniquet around Emma's arm.
Please keep your arm relaxed.
Emma followed the instruction. While preparing the syringe, Susan glanced toward Rianne.
Some patients decide quickly about tests, but others prefer to think about it.
Emma smiled slightly.
That was actually me earlier today.
Rianne looked curious.
What do you mean?
Emma laughed softly.
I kept wondering whether I should come to the hospital or just wait another day.
Nurse Susan nodded.
Some people sit on the fence when making health decisions.
Emma looked puzzled.
Sit on the fence?
Rianne also raised an eyebrow. Susan explained while preparing the alcohol swab.
It's an expression. It means someone can't decide between two options.
Emma smiled knowingly.
That's exactly what I was doing.
Nurse Susan gently cleaned Emma's arm.
All right, Emma. You'll feel the needle now.
Emma winced slightly but remained still. After a few seconds, Susan carefully filled the small tube with blood. Then she removed the needle smoothly.
All done. I'm going to place a small bandage here.
Emma looked relieved.
That was quicker than I expected.
For experienced nurses, procedures like this were routine. But the real skill was not the needle. It was the communication. Explaining each step, reducing anxiety, and helping patients feel comfortable even during unfamiliar procedures. Rianne watched closely. Because in healthcare, clear communication often matters just as much as technical skill. After the blood sample was sent to the laboratory, the next stage of care began. Monitoring symptoms and providing supportive treatment. Emma remained seated on the hospital bed while reviewing a few documents on her phone. Rianne stood near the window, quietly reviewing the notes he had taken during the previous procedures. A few minutes later, Nurse Susan returned with a small medication tray. She placed it gently on the bedside table.
Emma, the doctor has asked me to give you some medication to reduce the fever.
Emma looked at the small cup on the tray.
All right.
Susan spoke clearly and calmly.
Before I give you anything, I just want to verify your medication history.
Emma nodded.
Sure.
Susan checked the chart briefly.
Good. And I'll explain what this medication is for.
Emma seemed appreciative.
I like when things are explained first.
Rianne smiled slightly.
That probably helps patients feel more comfortable.
Susan nodded.
It certainly does.
She held up the small cup.
This medication will help bring your temperature down.
Emma reached for the water glass beside her.
Please take the tablet with a sip of water.
Emma swallowed the tablet and set the glass down.
Thank you.
Susan recorded the medication on the chart. Meanwhile, Rianne spoke.
I noticed something earlier. You and the doctor seemed to see eye to eye about Emma's treatment plan.
Emma looked curious.
See eye to eye?
Susan smiled.
That's a common expression. It means two people completely agree on something.
Emma nodded slowly.
So you and the doctor agreed on the best approach.
Exactly.
She continued writing in the chart. Then she turned back toward Emma.
Just so you know, this medication may take about 30 minutes to start working.
Emma leaned back against the pillow.
That's good to know.
Susan checked the monitor beside the bed.
And I'll continue monitoring your temperature for the next hour.
Emma looked calmer now. To Rianne, the moment was instructive. The medication itself was simple, but the nurse had done something equally important. She explained. She verified. She reassured. And through clear communication, both patient and medical team could see eye to eye about the plan moving forward. Because in healthcare, understanding often begins with a simple explanation. An hour later, the medical ward had become calmer. Most patients were resting. Emma lay comfortably against the pillow while scrolling slowly through messages on her phone. The medication had begun to work. Her fever was gradually decreasing. Rianne reviewed the patient chart while standing near the foot of the bed. Just then, Nurse Susan entered the room again. Her steps were calm and unhurried. She walked toward the monitor beside Emma's bed.
Emma,
I'm just going to check your vital signs again.
Emma nodded.
Of course.
Susan gently placed the thermometer again. After a few seconds, the device beeped softly. Susan examined the reading.
Good. Your temperature is starting to come down.
Emma looked relieved.
That's good news.
Susan made a quick note on the chart.
How are you feeling now compared to earlier?
Emma thought for a moment.
A little less dizzy, and the fatigue isn't as bad.
Rianne looked interested.
That's a good improvement.
Susan nodded slightly.
Progress often happens gradually.
She checked Emma's pulse once more. Then she adjusted the monitor.
Emma, I'm going to continue observing your condition for a little while longer.
Emma gave a small smile.
That sounds reasonable.
Rianne glanced at the chart again.
Earlier, you mentioned that ignoring symptoms for too long can become dangerous.
Susan nodded thoughtfully.
Yes, sometimes patients delay treatment.
Emma looked curious.
What happens if someone waits too long?
Susan spoke calmly.
Well, in some cases, the situation can become untenable.
Emma raised an eyebrow.
Untenable?
Rianne leaned forward slightly. Susan explained patiently.
It means a situation becomes impossible to maintain or manage safely.
Emma nodded slowly.
So waiting too long could make treatment much harder.
Exactly.
She checked the chart again and then looked toward Emma.
Emma, if you feel any new symptoms, please tell me immediately.
Emma nodded.
I will.
Susan gave one final instruction.
And for now, try to get some rest while we monitor your progress.
Emma leaned back comfortably. In hospitals, improvement often comes slowly. Small changes, gradual stabilization, and careful observation. For Rianne, the lesson was clear. Medical treatment does not rely only on medication. It also depends on timing, because when symptoms are ignored for too long, the situation can become untenable. But with early care, clear communication, and attentive monitoring, recovery becomes far more likely. Several hours had passed since Emma arrived at the hospital. The ward was quieter now. Most patients were resting while nurses continued their routine checks. Emma appeared more comfortable. The fever had reduced, and her dizziness had nearly disappeared. Rianne sat at the small desk reviewing the earlier notes. For him, the day had been full of new observations about patient care and communication. Just then, Nurse Susan walked back into the room carrying the updated chart. She greeted Emma with the same calm tone she had used throughout the day.
Emma, I'm just here to check how you're feeling now.
Emma smiled.
Much better than this morning.
Susan nodded and looked at the monitor.
That's good progress.
She wrote briefly in the chart and then turned back toward Emma.
Have you experienced any dizziness since the medication?
Emma shook her head.
No, not really.
Susan continued the assessment.
All right. Please let me know if the dizziness returns.
Emma nodded.
I will.
Meanwhile, Rianne glanced at the chart again.
I noticed that some patients don't talk very much during examinations.
Susan smiled knowingly.
That's true.
Emma looked curious.
Why is that?
Susan explained calmly.
Some patients are naturally taciturn.
Emma frowned slightly.
Taciturn?
Rianne also looked interested. Susan clarified.
It means someone who doesn't speak very much. Some people are naturally quiet, especially in hospitals.
Emma nodded.
That makes sense. Hospitals can feel intimidating.
Susan agreed.
They can.
She finished writing in the chart.
Emma, I'd like you to drink some water and stay hydrated.
Emma picked up the water glass beside her.
And try to sit up slowly if you feel lightheaded.
Emma followed the advice and adjusted her posture slightly. Susan watched the movement carefully.
Good. Take your time when standing up.
Emma smiled.
I will.
In patient care, recovery often appears through small signs: a calmer expression, a steadier voice, a patient who begins to sit up comfortably again. For Nurse Susan, these quiet improvements were familiar. And for Rianne, each interaction revealed something new. Because healthcare communication is not always dramatic. Sometimes, it is simply about listening carefully, even when the patient is naturally taciturn. By late afternoon, the ward had grown noticeably quieter. Most patients were resting comfortably, while nurses completed their final checks. Emma looked much better than when she had arrived earlier that morning. Her fever had decreased. The dizziness had almost disappeared. Across the room, Rianne reviewed the patient chart carefully. For him, the day had been a valuable learning experience. Just then, Nurse Susan entered the room holding the latest laboratory report. She greeted Emma with a reassuring smile.
Emma, I've received your blood test results.
Emma sat up slightly.
That was quick. Is everything okay?
Susan checked the report briefly.
Yes, the results look normal. It appears you were dealing with a mild infection.
Emma sighed with relief. Susan continued the discussion.
Based on your progress, the doctor may discharge you later today.
Emma looked surprised, but happy.
That's good news.
Susan reviewed the chart once more.
Before you leave, I'd like to review a few important instructions.
Rianne listened closely. Susan continued.
First, please continue taking the prescribed medication at home.
Emma nodded.
All right.
Susan added another instruction.
Make sure you drink plenty of fluids and get adequate rest.
Emma smiled.
I definitely plan to rest.
Susan pointed gently toward the chart.
If your symptoms return, please contact the hospital immediately.
Rianne looked thoughtful.
I noticed that treatment decisions sometimes change during the day.
Susan nodded.
That's true. In some situations, medical teams have to play it by ear.
Emma looked curious.
Play it by ear?
Susan explained.
It means adjusting decisions as the situation develops, rather than following a fixed plan.
Emma nodded. Susan continued with the discharge explanation.
I'll also schedule a follow-up appointment for you next week.
Emma looked appreciative.
Thank you.
Susan then added one final reminder.
Please remember to bring your discharge documents when you return.
Emma carefully placed the papers in her bag. Susan smiled.
And if you have any questions before leaving, don't hesitate to ask.
Rianne looked toward Emma thoughtfully.
I guess ignoring symptoms for too long could become the kiss of death for recovery.
Emma raised an eyebrow.
Kiss of death?
Susan explained calmly.
It's an idiom that describes something that almost guarantees failure or serious trouble.
Emma nodded slowly.
So coming to the hospital early was the right decision.
Sometimes recovery begins with a simple choice: seeking help, asking questions, and communicating clearly with the people who provide care. For Emma, the day had begun with uncertainty, but it ended with reassurance and a safe return home. The medical ward had become quiet as the day slowly came to an end. Emma had already received her instructions and was preparing to leave the hospital. For Rianne, The day had been full of learning, not only about patient care, but also about communication in English. He looked at the notes he had taken throughout the day and then turned toward Nurse Susan.
Susan, today I noticed something interesting. Most of the phrases you used were simple, but they were very clear and reassuring for the patient.
That's exactly the purpose of good clinical communication. Patients often arrive worried or uncertain. Clear explanations help them feel more comfortable.
And while we were talking with Emma, we also discussed several idioms and advanced vocabulary along the way. Those moments actually made the conversation more interesting.
Yes, they did. Sometimes expressions come up naturally during conversations, and they become great learning opportunities. During the day, we talked about a few idioms and vocabulary words like a dime a dozen, sit on the fence, see eye to eye, play it by ear, and kiss of death. We also came across some useful vocabulary like uncanny, vacillate, untenable, and taciturn. Hearing them in real conversations makes them easier to remember.
Throughout this episode, Nurse Susan also used 50 practical nursing phrases while speaking with Emma. These phrases covered many real situations nurses deal with every day: admitting a patient, checking vital signs, asking about symptoms, giving medication, monitoring recovery, and explaining discharge instructions.
So if someone watching this episode is a nurse or wants to become one, what should they focus on the most?
Focus on the dialogue and tone used during the conversations. Pay attention to how nurses explain things calmly and clearly. Those 50 phrases are very common in real hospital communication. If you practice them, they will become natural in your own speech.
In the subtitles of this episode, all the idioms, vocabulary, and nursing phrases are highlighted in yellow. You can pause the video, write them down, and review them later to help recall them more easily.
And even if someone watching isn't a medical professional, this episode can still help improve their English.
Absolutely. Listening to real conversations, learning idioms, and noticing useful vocabulary is one of the best ways to improve English in general.
Language improves step by listening, practicing, and repeating what you hear. Whether you are preparing for a career in healthcare or simply working to improve your English, every conversation is an opportunity to learn. Every consultation teaches more than medical knowledge. It teaches how professionals communicate under uncertainty, how questions are structured, and how complex information becomes clear.
In this episode, we followed another realistic doctor-patient consultation from our Medical English playlist and our real-life clinical conversation series.
And while the conversation focused on the clinical problem, we also naturally discussed several idioms and advanced vocabulary along the way, just like professionals encounter them in real conversations.
To improve faster, remember the FluentEars fluency method. First, listen to the full episode without pausing. Then, listen again and focus on the structure of the conversation. Finally, replay the scenes and shadow the dialogue aloud to build natural fluency.
This method trains not just vocabulary, but listening, pronunciation, and professional communication at the same time.
Consistency matters more than speed. Small improvements, repeated daily, build real fluency.
If you enjoyed this episode, please like the video, subscribe to the channel, and share it with someone who wants to improve their English.
And if you'd like to support the work behind FluentEars, you can support us through PayPal at paypal.me/FluentEars or directly on YouTube using Super Thanks.
Your support helps us continue producing high-quality educational listening episodes.
And it truly means a lot to us.
Keep listening, keep analyzing, keep building real-world English, and keep training your ears.
This is FluentEars.